Good evening, everyone. Welcome to tonight's second installment of FAFP webinars developed to assist Florida's family physicians and their staff in dealing with the COVID-19 crisis. Tonight's topic, COVID-19, best practices and perspectives from Florida's family physicians, will provide insights from our panel of 3 family physicians representing distinct practice environments and how each is addressing patient care during the pandemic. Our format will include 4 questions being asked of each presenter, who has developed slides per question to help participants follow along. Participants will be in listen-only mode, but can type their questions that our panelists can see and will attempt to answer either during or at the end of the presentation. Stay tuned for more information regarding next week's topic on Thursday, April 9th, addressing stress management and employment and financial resources during the COVID-19 crisis. My name is Jay Milson. I'm the Executive Director of the Florida Academy of Family Physicians and moderator of tonight's webinar. It is now my pleasure to introduce our speakers who will provide their own brief introductions before we get to the questions. First is Ajoy Kumar, FAFP past president. Dr. Kumar?
Good evening, Jay. Good evening, everybody. Thank you for giving me this opportunity. It is an extraordinary time for us. I am representing Chen Med. It is a primary care physician group that is located in 59 centers in over 39 cities. We are primarily a Medicare Advantage company. We have thousands of people in the Medicare age range. Specifically, this is the population that COVID-19 targets. So very happy to be here as part of this great panel with this fantastic academy. Thank you.
Okay, next we have Dr. Chris Scuderi, who's an FAFP board member and representing an employed physician practice.
Good evening, and thank you, Jay. My name is Chris Scuderi, and I'm the Associate Chair of Clinical Operations for the Department of Community Health and Family Medicine for UF Jacksonville. I'm also the Medical Director for UF Health Family Medicine New Berlin. And a little bit about our department. We have 30 locations located over 2 states and 5 counties, and our practices vary from solo physicians to large group practices that are located in Jacksonville's urban core to locations such as McClenny, Ponte Vedra, and Amelia Island. So we have a variety of practices, and I appreciate the opportunity to be here to share with everyone tonight during this crucial time.
I'm not sure if Dr. Scuderi is still on the line. He cut out there. Dr. Scuderi, can we?
I'm still here.
Still hear you? Okay, great.
Yes.
Okay, next.
Excellent.
Yep, I think we've got you. So next we have Dr. Terry Hashey, who's our solo practicing family physician who wears many hats from Jacksonville, Florida. Dr. Hashey?
Thanks, Jay. Thanks for the opportunity to share what we've done. Sometimes our purpose in life is to only be a warning to others of what not to do. I've been in practice and solo practice in Jacksonville, Florida for about 15 years now and 28 years in the National Guard. I'm currently activated with the COVID-19 response in the state of Florida. Our practice has 1 physician, 2 physician assistants, and a locum tenens who works once a week. Again, thanks for allowing me be here to be a part of this.
Thank you very much, Dr. Hashey. So let's go ahead and get started. As I said, we're going to go through 4 different questions. We're going to start with the first one. Each speaker will get a chance to answer the question, and then we'll move to the next one. So first it'll be Dr. Kumar. Can you discuss the major differences, changes occurring per practice environment during COVID-19 crisis in your practice?
Sure. I think one of the biggest things for us is really the rapid migration to telemedicine. For Chen Med, we've established the COVID-19 task force back in December. And because of all the issues that are going on, we rapidly moved into a cloud-based area in January and fully enabled our internet accessible platforms for all services, data, and applications so that doctors, care teams, and even front desk workers could be productive even when working completely remotely. That actually set the stage for transforming the practice with 59 centers in 39 cities from 90% in-center appointments to 90% virtual or telemedicine appointments in just 1 week. Because we have a lot of primary care physicians and support teams with 3 professional care teams, because our patient panels are fairly small to 400 versus the industry average of 2,300 to 3,000, most of our physicians were well connected on a weekly basis, and we continue to manage our patients remotely. So one of the biggest things that we had to do is, in order to do that, was to also change the mindset of the patients and the physicians. We're so used to the high-touch primary care environment, we had to kind of break that a little bit to sit there and say, we need to keep our patients happy, healthy, and at home. In order to do that, we have to change our patients' mindset at the same time too, to ensure that they're still going to get the great quality care that they get through Chen Med centers, but through the telephone. And if they really need to come in, we're going to bring them in, but only because we want to keep them happy, healthy, and home. That's why we don't want them to get exposed to the COVID-19 aspect. So keeping patients happy, that's one of the biggest things that we do. We do very VIP service for a lot of our Medicare population, and this is a lot of Medicare, Medicare Advantage, low income individuals at the same time too. So they get great care, they get very personalized care. A lot of those patients have our own cell phone numbers, and they communicate to us with text, FaceTime, what have you. That keeps the physician and the patient relationship really tightly bound. One of the other aspects is, how do you maintain operations? Well, this is one of the beauties of having a full risk Medicare Advantage based company, where a lot of your payment is paid up to you in front, and what you're doing is managing the health care of the patient for the next year. So we're very well financially situated in what we were doing and in the space that we're doing. And one of the biggest things that we have is internal communications. That was another challenge that we face, is that not only are team members managing patients remotely, we're managing team members remotely. So you need to make sure you have constant communications. And I can tell you, just about every single day at about 4:30 in the afternoon, we have team meetings, whether it's within an individual market, an individual clinic, or as an entire enterprise, we have a meeting. And this meeting involves the CEO and the CMO of the company and every leader at every role in the company. So there is a consistent message that is being given all the way across from day to day that just keeps on re-emphasizing that we need to really manage our patients in the outpatient and really work hard to keep them happy, healthy, and home without having to send them to the hospital, where the greatest threats really face them with COVID-19.
Oh, that's very helpful, Dr. Kumar. I appreciate that, particularly when you talk about prospective payment. That's a big issue that's surfacing throughout the community of family medicine that we're talking about, and in the future of family medicine, post-COVID, of how we can maintain those upfront payments. Yeah.
Absolutely.
So,
I think this is where one of our biggest strengths is.
Yeah, great points. Let's move on to Dr. Scuderi, talking about the major differences and changes that he's seen in his system-based employed physician environment.
Excellent. Thank you, Jay. And I appreciate Dr. Kumar's insights. And, there's some very similar insights and some similar challenges that we had in our environment. The largest change that we've seen has been the migration to telemedicine. We went from, at most doing 4 telemedicine visits in a day in our practice to doing 70 to 80 within 2 weeks. And so it's been just an incredible change, and very, very proud of our staff, very proud of our physicians, and very proud of our patients for adopting this technology and being willing to change at this time so we can continue to provide care. A big thing that became evident right away was just how important strong protocols are to protect our patients, to protect our staff, and to protect our physicians. It's important, that we establish protocols on how to triage patients correctly, protocols on how to maintain PPE and how to use PPE properly. And this week, we're working on protocols to limit time in the room for the patients who are still coming in, and making sure that the visits are as efficient as possible. I think that that's something that we want to limit as much face-to-face contact as possible for those patients who still need to come in. Another challenge that we are seeing is volume challenges. Many of us have practices where up to February, the biggest challenge we had was, where do we fit urgent patients, or where do we fit sick patients? And now many practices are seeing that their volumes have gone down tremendously during this crisis, especially those who have not made the migration to telemedicine. And so those practices need to start thinking, how do we engage our patients? How do we let them know we're here? In what ways can we recognize which patients need care during this time? What registries do we need to run? And so I think that that's a big question that many clinics haven't had to address up to this point. Another big challenge that we're seeing, and one of the ones that's near and dear to me, is employee stress. We're seeing our employees really have a tough time. Just there's the stress of, am I going to get sick, or am I going to bring home COVID to my family? And I think that's a huge stress on our employees. There's a lot of stress if they're going to be furloughed. They're seeing a lot of their colleagues being furloughed. And so I think there's a big worry about that. There's employers who are now working full time all day and then having to go and homeschool at night. And so it's a huge challenge. For us, we're in academic practice. Another challenge has been with our medical students. 2 days into this rotation, they were sent home. And so we've had to adopt to distance learning. And so that's been a new challenge for us. But I'm going to speak in the future about how our medical students have stepped up and made a big difference during this time. And the last challenge that we're seeing in big change is sick employees. How do we address when employees are sick? What protocols are there for if an employee has upper respiratory infections, or if somebody has tested positive for COVID-19? And so I think this is something that all practices need to think about. How are they going to handle this? Because if they're not seeing it now, they will be seeing this, and how to address it. And are they able to work virtually from home if needed?
Yeah, that's an important points, particularly as we look at the surge getting even greater, prospectively in the coming weeks. So let's move on to Dr. Hashey and get some perspectives in terms of the solo practice environment.
Thanks, Jay. Thanks, Dr. Kumar and Dr. Scuderi. It's sometimes I think we're all looking at this elephant from different angles. It's still an elephant, but we all see it so very differently. As the solo guy, as soon as this all started playing out, I called an emergency meeting with my director of human resources, my medical director, the director of marketing, our financial management person, our compliance officer, our public health advisor, the president, and our director of IT. And I found that I was alone in the room. And to cope with all these challenges as a solo guy, we had to make up a lot of lost ground. So I reached out to the hospitals I work with. We're truly independent, but we have our favorites that we do a lot of business with, and they really didn't have anything to offer at all. They had a lot to offer. They just didn't realize what they had to offer, knowing that they had entire departments of what I'm trying to struggle to do as one person. Reached out to our insurance partners, and they really didn't have a lot either. So we're making this up on the fly. And really where we're coming from, and Dr. Kumar and Dr. Scuderi are talking about some really awesome ways to maximize care for patients. They're talking about awesome ways to keep their patients safe. And we're in the survive mode. How do we stay alive, literally and figuratively, financially and health-wise? So the first thing we had to do is change our patient flow and protect our patients. But even more important than protecting the patients, we had to protect our staff. Because if the staff aren't healthy, they can't take care of the patients. So we changed our flow. We made a requirement to enter the building. You had to foam your hands. And very quickly, we went to the patients check in online, and then they call when they arrive in the parking lot. And when we're ready for them, they foam in, they don't touch the doorknobs. They either go straight to the exam room or straight to the lab room. However, if they're getting an INR or an A1C, we actually do the finger sticks in the parking lot, send them on their way, and then talk to them on the phone. So we're doing a lot of virtual visits and in-office visits, but we're making sure that we're keeping all the respiratory sick folks out of the office completely. We make sure when they come in the office, they don't touch any doorknobs, that's the job of the staff. We did some other environmental modifications. We took most of the chairs in the waiting room and lined them against the front desk so people would stay far away from our receptionist. We removed the magazines from the exam rooms, removed the magazines from the waiting areas to reduce our transmission as much as we can in our environment. So we're still working through this, and as all of you are struggling with the idea of billing, and it's a very dynamic change of what's required and what's not required. So to date, our biggest challenge right now is figuring out what codes to use, and then on the back end, figure out how to appeal the claims. But really, that's what we're working on in First Coast Family Medicine, and we appreciate being able to tell our story. Back to you, Jay.
Well, thank you, Dr. Hashey. I'm really going to miss that 1998 version or issue of Field and Stream in your office now. That's unfortunate, but it's a reality. And all kidding aside, I think we're going to be seeing a lot of new realities in terms of how we, adjust to making sure that offices are clean and safe, and hopefully it will improve overall health moving forward. At least something good that can come from this. So let's move on to the next question. We're going to ask Dr. Kumar to elaborate on providing examples of what worked and what didn't work to address these challenges. Dr. Kumar?
Yeah, thank you, Jay. And I appreciate what the other speakers are saying as well, too. And I echo a lot of their concerns. We are working in a dynamic area where, as I like to say, we're literally building the plane as we're flying it as it comes to managing COVID-19 and how we take care of our patients. With Chen Med, as I mentioned, we manage the vulnerable population, and that vulnerable population is anybody that's in Medicare Advantage primarily, and they are often low-income individuals. So they are dealing with not only their healthcare issues, but also their social determinants of health, and then on top of that, the scarce resources that we have all around us here. So that's been quite a challenge. So how do we manage that? We only have appointments if they absolutely need to come. We bring them in, much like what Dr. Hashey said. We really ensure that pretty much only one patient is in the waiting room at a time, and we space out our patients pretty significantly for if they have to come in. And they have to be able to come in for a specific reason. And a lot of this we had to train our patients too. They got so used to us seeing them either on a daily basis or on a weekly basis. We definitely see them on an every single month basis. So this is a whole new thing for them, not to be seen as often. So we have to train them for that too. But majority of the patients that we've come across, they've really appreciated that we're looking out for their health, and they often thank us for not bringing them to the clinic and trying to keep them out of the hospital. So anything that we could do, they really are all in with us in that regard. Regarding telemedicine, I think IT was a big thing here. And the IT staff at Chen Med, they're spectacular, absolutely spectacular. They have a homegrown IT system with the EHR, and they've really rapidly updated the system such that we're on the verge of really doing live stream video within our EHR at the same time too, and be able to take our notes and prescribe medications, really using the robustness of the EHR and how it's meant to be used. And again, I could say this because we work in a value-based full risk model, and we have a lot of latitude to do a lot of different things. And we have a fantastic clinical IT team that's doing really well and getting us to that point in order to service our patients with that VIP care. Regarding the constant communication that I spoke about earlier, we use a program called Ring Central. We run all our calls to our patients through there. We talk to one another on there. We text to each other one on there. And there's even going to be at some point in time a video capability that's coming to that platform as well. So everybody carries that on their cell phone. You don't need to have it on a laptop. Every cell phone can download it. Everybody can use it, and it's really encouraged to use too. So that's been very beneficial in that regard. When it comes to the clinic scheduling, as I mentioned earlier, we're really practicing that social distancing. There are some clinics within the Chen Med markets that have taken out weight chairs and they space them 6 feet apart. We bring in patients. We tell them you can only sit on a particular chair, so that way we don't contaminate all the chairs. And we're very, very thoughtful of how we go about this approach because we really mean the social distancing component in this. And the patients understand as well too. Again, we limit the clinic contact for people that really need to come. And just as Dr. Hashey mentioned, in our Louisiana market, they're getting hit pretty hard. They started doing a lot of things through the drive-through process. So that's quickly spreading around our entire enterprise. We're doing INRs out there. We're checking blood tests out there. And we've actually done some testing out there as well too. So there's a lot I think every single practice can do just by learning off what we're doing and what the others are doing at the same time. Regarding COVID testing, the real question comes down to who to test, where to test. We're following the CDC recommendations. Instead of burning necessarily our own testing kits, there are community places around Pinellas County, where we live in Pinellas County, Florida, in which other health entities have set up rapid testing and then mass testing. So what we have often done is that we've taken these centers and we've referred our patients to those centers so long as they meet the CDC criteria. And all we do is just write them a letter saying that the patient really meets CDC criteria in order to get the testing done. And our patients are really good. I just had a recent patient just tell me that they were COVID negative. So that being said, I still told that individual, you still have to maintain your social distancing. Please stay at home, and they were completely in agreement with that. Again, we're going after the social determinants of health. We're buying our patients groceries. We're buying our patients toilet paper. We don't want our patients to go roaming around Publix and places like that looking for toilet paper and getting COVID out there. So we have social workers that work with us, case managers that go out and get these products and deliver it to our patients' homes. So we provide that really high-level VIP service of care just to keep our patients happy, healthy, and at home.
So how about next phase? What you pretty much cover that?
Yeah, I mean, from the next phase standpoint, really for us, it's, you know, how do we use our data, and how do we use our data and our management of that data in order to get to the next step, which is predictive analytics. How do we know when somebody is getting sicker? How do we know that they're decompensating before they even know that they're decompensating? You know, with our patient population, we ask them to do a lot of things. Some people forget, some people don't want to do stuff. So, but if we start changing the behavior in some of these individuals and put some remote monitoring technologies out there that can send us back information straight to our EHR, I think that will really help us monitor our patients that much closer. It doesn't replace that patient-physician relationship. It only augments it even more, because we know what's going on with our patients before they know what's going on with themselves too. And I think that's really important. Now, in terms of the deeper dives in the social determinants of health, I discussed that aspect. You know, a lot of our patients are challenged in terms of their social determinants of health. I had a patient just a few hours ago. The only thing that she gets is $980 a month. That's it. That's all she lives on. So we have to provide her with services, medications. So we distribute medications. We actually buy them food. We do what we can, and we do what we must in order to manage our patients to prevent them from going to the ERs. This is part of who we are as a company, and our CEO and our CMO are deeply committed, and so is the management team, in getting this done. So it's been very helpful. And of course, Chen Med right now is in a phase of hyper growth. So we are actually hiring. We're hiring all over the United States right now. We know what we need to get, and we're really pushing for getting PCPs, business folks, because we really want to grow into a lot of our markets that we have. And that leads to growing a workforce and leadership dyads. That's just as important, because in order to go with the hyper growth, you need to have the leadership there too.
Right. Yeah, that is important. Dr. Scuderi, let's move on to you and provide examples of what worked that didn't work within the UF Jacksonville Health System.
Sure. So, you know, when I think about, you know, what worked, Jay, the biggest thing I can think about is our people. You know, I really think about this past month, what's really stepped up is our leadership. And so, you know, the first is Dr. Nipa Shaw, our chair, has really anticipated this coming and helped organize Zoom meetings for our staff. And so our staff was able, and for our physicians, even though we're located over 2 states, to get together over lunch and to talk about the challenges and the protocols that were coming up. The second is I want to recognize Dr. Jeff Jackmine and Dr. Chuck Haddad. Both of them have volunteered to have their clinics as our respiratory clinics. And so our patients who have upper respiratory symptoms in the system can now go to 2 clinics, and that way they could be screened and tested for COVID if necessary. And it's been a huge help to the rest of the clinics, and we've been able to save a lot of PPE by sending it to those clinics. I'd like to recognize our medical students. Militant Oliver and Natalie Applebaum have been fantastic. So when they were sent home from the rotation, they came back and asked, what can we do to help? And so we let them know we need help getting our patients on telemedicine. And they did an amazing job. They helped us to go from 4 visits in 1 week to over 70 by contacting our patients and helping them get signed up for Zoom. I'd like to recognize Dr. Christy Alexander, the FAFP president, and you know, Jay and Adam and the team at FAFP. You guys have been working 7 days a week advocating for all family physicians in Florida. You know, it started with the encouragement for payment parity for telehealth, and then last week it was a letter to Governor DeSantis asking for the stay-at-home order, which goes into effect tonight. And so I just want to thank you guys for your advocacy. I want to thank my staff. I think that them being resilient and being able to pivot quickly has made a big difference and really embraced telemedicine. I joke around with them and call them the Zoom crew now. And then also, we've been building a tool called a predictive analytic tool for readmissions over the past couple of months. Weren't sure when it was going to be deployed, and now is a great time for it to be deployed. And so we've been working on this over the past week to identify who is at highest risk of readmissions based off of their social determinants of health and other factors. It's been a tremendous help in identifying which patients we need to keep close contact with during this time.
You want to talk about next phases?
Sure. And I think, this is a challenge to all of us. Each week brings a different challenge with COVID-19, and we always have to be thinking about what are the next phases? How do we stay a step ahead of this? And so for this week, our next phase was a partnership with the local food bank, trying to identify if we see patients who have food insecurity, how can we help them? And so our local food bank said, if we identify patients, we contact them, they're going to put food aside for our patients, which has been a great help. One of our physicians in our practice is very interested in lifestyle medicine and is working on creating videos to encourage our patients to stay healthy during this quarantine and to be the healthiest people they could be, because a lot of people are struggling being at home. And so I think it's important we have to look at how we engage our patients during this time. I think there's a challenge for all of us to just keep getting the word out that we're providing telemedicine. To many patients, this is a foreign concept. And so we've worked very closely with our media team and our social media team this week to try to find new ways to engage our patients, to let them know, hey, we're here, just in a different way. A neat concept, and one that I think, we all have to think about as family physicians, is how can we support our local hospitals? And so up at Brigham and Women's Hospital in Boston, they've been using this hospital at home concept where patients who are moderately ill with COVID-19 are sent home with monitoring equipment and oxygen. And then they have a telemedicine visit with a physician and 2 nursing visits a day via telemedicine. And so I think we who have some time to prepare here over the next week or two in certain areas of the state for the upcoming surge need to think about how can we help our hospitals in unique ways. And then I think the last challenge is a big one, is staffing. How do we modify our staffing as things change? How do we let physicians work from home? How do we modify our staffing if our physicians are now doing predominantly telemedicine? Are there different roles our medical assistants can do? Can they work registries? Can they reach out to patients with chronic diseases? Are there certain staff members who want to use vacation now? And so I think it takes some creativity to make sure that the clinics are adequately staffed but not overstaffed during this time.
Yeah, that's great. And the creativity phase of that is what I think everyone on this call would appreciate, from the sense that, these are uncharted territories. I mean, we're trying to figure out how to manage within something we've never managed before in a historical event. So that's very important and appreciated. Dr. Hashey, let's hear from you in terms of what worked, what didn't work in your practice.
Thanks, Jay. My mom always said end on a positive note. So I'll start off with what didn't work. What didn't work is what I mentioned earlier, is asking the folks I thought that had the experts for help. And that just didn't quite work out very well. I also was on a cruise while this was all breaking out. So luckily I paid for the ultimate internet package to start my planning. But by being disparately located, I wasn't able to set my plan in place. But then I was also quarantined, and trying to get COVID testing for myself and for my family so I could get back in the fight with the National Guard or get back into my practice was daunting at best. Being priority as a first responder, it took 10 days for my testing to come back to get back to work. But some of the things that worked are pretty exciting. The patients love the extra attention. They are more scared than we are about getting sick, and worse than that. So the fact that we're making all these extra efforts, even when we make them come in for labs, once they get there, they're very reassured. And when we start the video conferences with Doxy.me, the anxiety level goes down, and they're very appreciative, and it really has continued our quality of care. What really worked is copying the cruise line protocols. The cruise lines are, believe it or not, pretty slick in infectious disease prevention. After all the bad press about the norovirus, and now with the COVID-19, the ships being stuck offshores, most of our protocols, believe it or not, didn't come from our hospital partners. They came from our cruise line examples. And working with the staff and being transparent, I explained to them what our goals are. Our priority number one is keeping our staff safe and healthy, because if we get sick or we show up sick to work, we're not going to help our patients. We're going to make it a lot worse. The next priority is keeping our patients healthy, whether it's keeping them out of the office because they have respiratory illness, or getting them testing, or getting them in the office for an evaluation. That's our number 2 priority. Number 3 priority is keeping the doors open. We're already getting questions about how do we continue our staff salaries. That leads me into the next question is diversification. One of the things that's really set us up for success is a significant part of our practice is a capitated panel. That's a Medicare Advantage plan that has a steady income stream to make sure we level off. We're also looking at some of the government programs. The best thing so far that ties all that together is being active in organized medicine, to be a member of the Florida Academy of Family Physicians and an active member to know to reach out and have these resources available. I had the opportunity to talk to Senator Scott on behalf of FAFP yesterday. We have these telemedicine, these conferences, so I can be a presenter, but also a participant and see what other folks are doing. The FAFP introduced me to Doxy.me, which has been a fantastic product for us and for our patients. So those are our challenges, what didn't work, what worked so far, and I think it's setting us up for success going forward.
Next phases?
Next phases is capitalizing on our current momentum. We've got to keep our staff healthy, so we've gone where we are in the process of switching to more of our staff teleworking, and keeping them out of the office if they're ill. And the idea is we are all going to get sick at some point. And if we can stagger the illness and keep it mild, so that, hey, if you're sick, stay at home, you can do the referrals, you can do the check-in. We have one of our PAs in the office actually seeing patients, and doing telemedicine. The other PA is doing exclusive telemedicine to make sure we have continuity of staff. The continuity of income, as I mentioned, is partly to our capitated partner. It's also working with our bank and the Small Business Administration as far as these new government programs. We're learning as quickly as we can, understanding how this all works. Our priority, number 1, is no layoffs. We will not lay off any employees. I'm not sure if it was American Airlines or Southwest Airlines back in the 70s, I believe it was, when the airline industry took a dump. But when other airline partners were laying off all their employees, this airline went to their staff and said, look, we're taking a beating. We cannot pay everyone what they're used to being paid, and we can't afford to fight with the union. So everybody took a cut across the board, which I hope we're not going to do. But once they stuck together, weathered the storm, we all knew the airline industry was coming back. And when it came back, that airline company was the only one positioned to take on the influx of business, and they did the best of all the partners. So what we're hoping to do is keep our folks healthy, keep them paid, and then position ourselves so that when this all blows over, we will have batched up our wellness visits, our chronic visits, and hopefully our new patients as folks have newly discovered the value of health. That's what we got, Jay. Back to you.
Well, thank you, Dr. Hashey. All great points, particularly, and I know that's something that we will touch on next week that Chris Newland, one of our presenters, will talk about, is in terms of employee, issues that you have within your office, hiring, firing, furloughs, those types of questions. But we're getting some questions now. We will get to them at the end of the presentation. Let's move on to our next question. Dr. Kumar, let's talk about some specific techniques to motivate the team during the crisis.
So this is where we're very good at really recognizing team members. There's always a way to appreciate our folks. You say the appreciation, and then you show the appreciation. And it's the little things, little thank yous, little lunches, dinners, what have you. It's the little things that the clinic managers do with the frontline folks, and the physician leaders do too. We work as a team. Now, granted, half the team is home and half the team is in the clinic. We're forced to, in a lot of ways, be very creative in the roles that we play. So we help one another. So we show a lot of appreciation each day, in the morning and in the evening, as to what we're doing, because what everybody's doing is keeping people out of the hospital, and that's a big thing for us. The dinners help, The lunches, there's a lot of gatherings that we do on a monthly basis to not only go over the data, not only go over the results, but also even from the CEO down, gets on a video call to thank each and every person. I think that's very personable, very unique in a company, and Chen Med's very good at that. The constant contact with teams, that's another aspect too. You can't communicate enough in a situation like this, whether it's to all your leadership, and then from leadership down to the regional, and from the regional down to the individual clinics, and then really support them, because it's the clinics that are doing a lot of the work. It's the frontline folks that are doing a lot of the work. So a lot of the leadership has taken a very forward-leading position and sitting there saying, how can we make your job easier for you? How can we help our logistics folks? How can we have our operations folks do something that you don't need to necessarily do, that the folks that are now home can pick up that slack? So there's a lot of redistribution of duties from the frontline folks to the folks that are working at home. See, in our company, we don't lay off, and we haven't laid off anybody. People are working from home. We're protecting our folks, and those folks have a lot of things that they can do that can support the clinics. And we're very appreciative of that fact, and a lot of the frontline folks are happy that they're capable of doing that, and the folks at home are happy to be engaged as well. They miss, obviously, being in the clinic, but they understand why they need to be home and understand the fact that what they do at home is critical to our overall mission. Social media highlights. If you guys hop on Twitter, if you hopped on LinkedIn, we're always sharing all the stuff that we're doing on both of those platforms there. A lot of our clinical leaders, they're interviewing all our folks. Those frontline folks are being positioned in social media to sit there and say, look at all the wonderful things these guys are doing to protect their senior population from getting admitted or getting COVID or getting sicker. So this is a really great tool to have to sit there and say, not only are we saying that we appreciate you, we're showing it because we're showcasing you on the entire internet, so that people can see what great things you as a leader, you as a clinician, you as an MA or care promoter can help in managing our patients. Last but not least, as I mentioned, the team lunches. Those are a time that we truly do block off so that the team can get together and enjoy a meal and be themselves. It's really important for the team to connect in a situation like this. Granted, we may have 1 or 2 patients come in. We really value that time that the team sits down together, whoever that can, and then we really protect them such that they can enjoy their meal in peace. You need that bit of just solace and that bit of just that quietness, just to reconnect with one another and then be able to go back and take care of your patients.
That's good, yeah. But at least 6 feet apart. Let's be honest now. So thank you for
Yes.
that. Let's go to Dr. Scuderi and talk about things that he's done in his practice.
Sure, and I just want to thank Dr. Kumar. Those are great ideas. You know, and I agree. I think food is a great way to help our staff right now. Just having a weekly meal makes a big difference and really motivates the staff and really speaks to them. I think anything we can do to promote a team-based culture is crucial right now, especially with the amount of staff stress that's going on. One of the things that we do is we have a whiteboard in the center of the practice, and we have a quote of the day. And lately, it's been challenged to find very inspirational and challenging quotes, knowing everybody's stressed, and everybody facilitates that. That's what everybody gravitates around each day. One of the important things that we started to do when this whole pandemic started was developing a Sunday night plan of the week that went out via email. It would have 10 steps, and I would send that out every Sunday night. It would give an update on what's going on at the local testing center here in Duval County, so all our physicians were aware of who can be tested and what the qualifications were. It would talk about changes in any of the protocols, so everybody was aware of that. And then I would give goals for the week, such as being at 75% telemedicine by the end of the week. And so I think it's very important at this time that we communicate regularly and clearly with our team, and laying that out at the beginning of the week so when everyone gets there Monday morning is very important. Something that's easy to do is to get to work 5 minutes early and do a daily walk around. I try to say hi to every member of the team and just see how they're doing, just to get a pulse on what the climate of the clinic is. It's important now just to see where everyone's at. And if you notice the climate's wrong or if there's an issue, have a leadership debrief. Bring everybody together. We go out in the parking lot, stand 6 feet apart, maintain our social distancing, and have a quick meeting to address whatever challenges are there to make sure everybody's on the same page. I think it's important now more than ever to keep our regular meetings. And something that we did that worked really well yesterday was we did our meeting via Zoom. Even though everybody was in the clinic, we wanted to make sure that our staff members were comfortable with Zoom. In case everybody had to work remotely, we wanted to make sure the staff understood how to use Zoom, each of its components. And the nice thing about this was the staff really took well to the chat feature. We had 15 to 20 questions, and I think people were more free using the chat feature than they would be standing in a room. And so it worked out really well. And I think the last thing we need to do, and the most important thing, is it's a stressful time for all of us. All of us are under different stressors, whether it's financial, whether it's health, whether it's just what's going on in our practices. And so it's very important now that we return to our why. Why did we become a family physician? Why do we do what we do? And it's important that when we have that why, that we're able to communicate that to our staff, because that's what they're going to follow. And so I think at this time, having a clear why and showing that to your staff is crucial.
Yeah, those are really good points. I mean, particularly the perception element of it. I love the Sunday night plan of the week and the daily walk around, because, obviously I run a very different office with just, 5 people that run the FAFP, and they do a wonderful job. But just understanding body language to, people's, how they're, what may be impacting their day and how they're going to be capable of, carrying out the mission of your practice is really important. So those are some excellent points. So let's move on to Dr. Hashey, who certainly has a smaller group, but nonetheless the same in terms of the importance of working with the staff and making sure he's connected with them.
Size doesn't matter all the time, Jay. One of the best things we did for team building is we packaged up all of our field and streams that were more than 15 years old, and we shipped them to you.
I know.
So you should be getting that anytime now. So really, our theme is altruism and family. We don't make widgets. We take care of people, and in the most mundane environment, the most mundane visit, we make differences in people's lives, and every once in a while we save a life. And that's really important to tell the staff and remind them, and develop this culture of altruism and significance of all the little things we do, that from the person who answers the phone to receiving them, to bringing them to the room, to the practitioner, the person checking out, is that everybody in that chain is critically important to the success of that patient. We're family, and we're not just the kind of family that you just talk about and say, hey, we're work family. You've got 3 families in your life. You've got the family you were born into, and you had no choice in that whatsoever. You had the family you were married into, and you probably made some bad decisions if you're like most people, but you're stuck with them. And then there's the family that you work with, and you spend more time with the family you work with than the one you were born into and the one you married into. And if we treat ourselves like a family, we've got black sheep, and we have our good days and bad days, but building that bond right now carries us through times like this, when people are scared, when they're worried about bringing something home to their family, or bringing illness to the office, or doing the right thing to patients. When they take that altruism and the idea that we don't make widgets and we're a family, carries all the way through everything what we do. And then it comes down to the bottom line is they're important, and their jobs are safe, and their health is safe. So that's what we got, Jay. Back to you.
Yeah, well, I can certainly appreciate that. I think my staff who's on the line as well is going to think that I'm stealing all your material when we talk in the office. But it is true. You spend the majority of your time with those folks, and so it's important to understand where they're coming from, and that they buy into the mission of what you're trying to accomplish, and staying connected with them is important. All right, we're on to our last question. It is, what are positive? Do we want to end on a positive note? So what are the positive changes that may come out of the pandemic from your perspective, Dr. Kumar?
I think one of the biggest things, sure you're seeing my picture right there, next generations, right? We're dealing with not only just this generation, but next generation. What we do today impacts multiple generations. So we have to empower the patient-physician relationship through the augmentation of technology. We got to solidify the value-based business model. Our entire business stream is really value-based, and it's really showing that you can actually do this in a pandemic, and you could actually keep people out of the hospital in a pandemic, and you could actually keep them happier, healthier, and at home during a pandemic, and not have to spend the wild amounts of money and drive people into bankruptcy in order to do any of those things too. We're also develop market relationships and partnerships to address social determinants of health. That's a huge thing. And to do that during a time of pandemics is truly extraordinary. But the only way that works is if you work in a value-based stream and that you really work with other partners to help you do all these kind of things. And it's all about process. You got to have really strong internal process that manages the IT system, that manages the coding system, that manages every one of these little things that you do on the back end. And that allows the support of the PCP care-led teams that we truly do right now. I think the last thing is really what it comes down to is that we're developing deeper relationships with our patients and our communities, with our workforce and with our families. You know, technology is very helpful. We're able to do work at home. We're able to do work anywhere. We're able to communicate with our patients. We're able to communicate with our coworkers, and it's really brought us together. I know communication can drive people apart, but this is one of those things that, you know, we're really focusing on each and every person. So relationships matter, and we're really infusing communication, technology, health, medicine, true healthcare, and really improving the care of not only our community, but also of ourselves at the same time. I think the biggest thing that you're going to get out of this is that you're really going to build a stronger community through relationships. That's the only way you're going to get through this. Thank you, Jay.
Yeah, that's helpful. And so we're going to come back to you on our question on social determinants of health that one of the participants has asked. But let's go to Dr. Scuderi and see what he thinks is going to come out of this from a positive perspective.
Sure. Thanks, Jay. And, you know, I think that the era of telemedicine's here. And so we've seen it kind of coming slowly. And I think that, you know, now, you know, if you would ask any of us January 1st, if we'd be doing predominantly 80, 90%, 100% telemedicine at this point, none of us would have taken that bet. And so I think that we're going to see our practices greatly different when the pandemic's over, that we're going to see more hybrid practices where we embrace telemedicine. Our patients are embracing it. They're really enjoying it. And I think that our practices are going to be greatly different 6 months from now, a year from now. The other thing that's been nice about this is I think the payers are starting to recognize how valuable our pajama time is, that they recognize that those phone calls, those emails, they matter, and they're showing value for that. And I hope they continue to do that because the work that we do after hours is what provides great care for patients. And especially in a time like now when our patients are struggling and there's a crisis, and we need to do everything we can to keep our patients out of the hospital, they need to recognize how important that time is. I think, you know, there's hopefully better preparation for next time. I think that this has been an awakening for our country and for the world. And I think that we all have to, you know, look at what we can do differently next time and what we can learn and how we can do this better. I think all of us will appreciate our battle buddies. There's people who have gotten us through this pandemic and will get us through it. And I think that those that we have worked closely with during this time will be those that we will remember forever. And so we need to, you know, support each other during the ups and the downs. I tell you, the one thing that's just been amazing and the one thing that has really inspired me the past couple of weeks is there's not a day that there's not an act of kindness or multiple acts of kindness from our patients towards us. We're so used to ministering towards our patients, but yet during this time, our patients have sent so many thank you notes. Many of our patients have made handmade masks. Many of our patients have sent notes saying, hey, we're praying for you. We're praying for the safety of the clinic. And it's just amazing to see how much our patients appreciate the work that we do. Sometimes we forget about that, but it's really been a very special time and something that has been very encouraging, you know, during this time when there's so many challenges. And then I think lastly, it's given us all the time to slow down a little bit and think about what is important. You know, we're not able to travel or eat out as much. And so it slows us down to really look at our priorities and our values, and does our work support our priorities and values? And so sharing a picture of my kids and you know, Grace and Blaze haven't seen another child for 3 weeks, but you know, it's been really interesting to see their friendship develop and see their bond develop and see them learn how to be better friends. And my hope is from this that, you know, we will all have stronger friendships and families and stronger relationships, because I think this whole situation has slowed us down to really appreciate those that are close to us.
Yeah, you know, those are all great points as well. You know, I've spent my 27 years in organized medicine, you know, helping lead physicians, and I can tell you there's not a better group than family physicians that understand the things of what you just spoke, and how much we appreciate it from a staff and working for the family docs. It's an amazing group, and that's why you get so much positive feedback, is because you are amazing people. And so let's have Dr. Hashey hopefully give me another zinger and close us out here on the positive, hopefully, outcomes of the pandemic.
You know, Jay, you can't set me up for those things. I have to be spontaneous. I don't have one for you. Most of the things I think are going to be positive coming out of this are the mushy things, kind of like what Dr. Scuderi was saying, is people have gotten so desperate apart from each other in their phones and technology that now we're realizing society is really interdependent and frail, and that we actually depend on others. And maybe the people on the television or on the sports field or seeing on stage aren't quite nearly as important as a fireman and policeman. And wow, did you even realize that a warehouse worker and a truck driver and a grocery store employee are critically important to our survival? Not just to go out and get ice cream, but we can't live without these people. We're flipping our hero vision upside down in America. So we're changing our view. I've been trapped in a cabin on a boat and in my house with my family for weeks, and you know, I've got to know them. They're kind of awesome. We're spending time doing things like learning how to fix and build things around the yard and sprucing up the garden. And it's time with people and not technology. It's an opportunity for us individually and collectively as a society to press the reset button. And like Dr. Scuderi said, figure out what's really, truly important. Back to you.
All right. Well, that wraps up the presentation element of the the program here. And so let's move on to some questions. I'm going to start out with one, and I'm going to do my best to pick someone to answer it based upon the things that were discussed during the presentation. I'm going to go to Dr. Scuderi first. This comes out from someone not too far away from you. I won't reveal her name, but I know she's close in practice to you. What level of PPE are you using for the few, hopefully non-respiratory patients physically in the office? We're mostly telemedicine right now.
Sure. So, you know, it's been interesting. There's been an evolution. So obviously anyone that there's been any concerning symptoms for COVID, you know, we're using an N95 mask, we're using a face shield, and we're using a gown and gloves. This week we've started, especially the past 2 days, have started to use surgical masks during the day for any patients that we're seeing in gloves. You know, I think the data is starting to change that, you know, to show that, you know, there is a positive effect for that. And so that's been a change in the past 2 days in our protocols. And it, you know, UF has very nice protocols depending on patients' illnesses, if they're immunocompromised. And so we just try to follow the protocols through. But in the past 2 days, you know, our practice has changed that everyone is wearing a surgical mask during the day.
Yeah, I'm going to ask you to follow up on that with another question. Do you keep more than 6 feet distance, as the virus apparently can travel more than 15 feet and stay in the air for 3 days? That's a question from one of our participants.
Sure. So I think, you know, in an office, it's difficult to keep 15 feet, but I think, you know, we're trying our best to maintain 6 feet. You know, one of the things that we've done this, you know, over the past week has been trying to limit how much time we spend in the room with patients. So when a patient comes in to see me, I will, you know, introduce myself, say hello, and then get their cell phone number, go back to my office, do the history, do the review of systems, come and do the physical exam, see if they have any pertinent questions, and then go back out and do the assessment plan with them via phone, trying to eliminate how much time we have in the room, you know, with patients to decrease the risk. When we have our meetings, we're trying to keep everybody outside to do our meetings and keep as far apart as possible. And so I think it's just being aware of that and trying to maintain as much distance as you can with the space that you're given is important. Yeah,
that's very helpful. I'm sure they'll appreciate that. You know, I mean, it really comes down to, you know, that true social distancing and you know, keeping as clean as we can in any circumstance, whether it be COVID, flu, or any other you know, virus type situation. Let me go to Dr. Hashey. Someone wanted you to elaborate a little bit more, if you could, on maintaining salaries and hours for staff despite the lost revenue. Can you elaborate a little bit more on that?
Well, I can give it a try. We're making.
Yeah.
Well, we're giving it a try. It's too soon to tell right now because our revenue cycle it hasn't caught up yet. So we're behind on you know, we're getting paid for the work we did a couple of months ago because we're well, I won't get into our reimbursement with our insurance companies. That's a whole other webinar, right? But
yeah, and that's yeah, we're not doing that. That's restraint of trade. We antitrust. We're not doing that.
so what we're doing is we're just trying to keep the business flowing, and so what I try and I want to my policies I try to make into a culture. We have a culture of always do the right thing. And if we always do only the right thing medically and we forget about the business, we go broke. If we only do the business and forget about medicine, taking care of people, we go broke because people don't like us very much. So we're always trying to give that balance. So we're trying to keep the visit volume up, but appropriately at home. And then we're also trying to figure out how in the world to submit the claim so that we can get paid appropriately for that work. My backup plan is my salary is going to take a hit to preserve everybody else's. And then going after the federal dollars and the forgivable loans and the non-forgivable loans and the grants. And I'll tell you what, in 6 months, I'll tell you if I was right or if it didn't work.
Yeah, well, true. And I think that revenue cycle management is going to be a big deal for everyone. You bring up an excellent point of, we're just too soon into it to know where those EOBs are going to turn out. So let me go to Dr. Yeah,
so
go ahead.
Here's my prediction. My prediction is that we're going to get paid. We're going to bill out a 99214 with the appropriate modifiers that Medicare has told us, expecting to get paid a 99214, and then we're either going to get paid $15 for a televisit, or insurance company A is going to say, oh, I'm sorry, the 25 modifier should have been on the other code. I think that's the next thing that's going to happen is when the EOBs come back, there's going to be shenanigans and monkey business that we're going to, because we're a part of organized medicine, reach back out to FAFP and AFP to advocate for us.
Absolutely. That's what we're working on, both on the state and the federal level. I'm going to move to Dr. Kumar. I had mentioned about social determinants of health. Someone asked, how does your practice afford addressing those social determinants of health, such as buying groceries for patients and et cetera?
So Jay, that's a fantastic question there. Chen Med works in the value-based high risk, full risk category. So what does that mean? That basically means that you get a big chunk of money based on all the codes that you put in a year and a half before to what your expected level of severity of your patient is. So if you got a bunch of really sick patients, you need to have the resources in order to manage those sick patients until they get healthier. Well, how do you do that? You really empower your primary care teams to provide that real great service. You detect and manage really the high risk disease conditions. And we work those hard as a team. We limit those hospital days that the patients get. So we limit hospitalizations. So that delta that you get from preventing patients to going to the hospital versus what you get from your payer, that delta can be used however you want to use it from a business standpoint. So a lot of this is to support the team's growth of the business, growth of the organization, but also there's a pot of money that the owners have really truly believed is that you need to transform the care of the entire country and the neediest populations. So that pot of money is really set aside, and it's really encouraged to use that money to help with the social determinants of healthcare, because we know if you don't manage the social determinants of healthcare, it doesn't matter how much insulin that you give, it doesn't matter how much blood pressure medicines that you provide, the patient's going to end up back in the ER, which is going to eventually lead to a hospitalization. And in a full risk model, you're paying for that hospitalization. So we use all these funds on the front end so we don't have to pay the back end costs. So we're trying to prevent these admission, which is a lot of preventive healthcare. That's what we should be doing in primary care medicine. Prevent the high cost utilization of hospital services. And we do this very well because we have a lot of processes in place. So whatever money that's saved, as I mentioned before, goes to our patients and our staff, the people really doing the work and the individuals that we're trying to support.
Boy, that really takes comprehensive care to the next level. So thank you very much. I'm going to throw this one out to anyone, the first one who wants to grab it, and I'm going to probably, my non-medical self, stumble on these. But what are the current recommendations regarding the prescribing of hydroxychloroquine and azithromycin? Anyone? It's not going to be me, so.
Well, I will tell you this, the FDA recently approved hydroxychloroquine for the use of managing patients. I would highly recommend that you do it on an inpatient basis versus outpatient for a variety of reasons. And I've heard stories about people doing it in outpatient, but you really got to monitor that QT prolongation. You really got to make sure that, you know, the QT prolongation, the hydroxychloroquine, as well as the azithromycin don't combine and then end up putting the person in torsades. There are some case examples out there, but I think we need even further definitive data. But right now, the FDA has approved it.
Any other follow-ups to that?
And I think, you know, if you look at when the expected peak is going to be in Florida, we're one of the latest. They're expecting May the 2nd is one estimate I saw today. I think we're one of the 3 latest states. And so the hope is that as the peak is late here, we'll see more studies. We'll have, you know, more evidence-based data on exactly what is the best protocols, you know, to help really, because, you know, it looks like the cytokine storm is what is putting the patients at risk. And so how do we knock that down? And so I think that, you know, just as every day that goes by, you know, there's more and more data that's coming from, you know, systems around the world on what's working, what isn't working. And I think we just have to stay up on it. It's a changing target every day. It's just been amazing. And I think every one of us is learning. And I think it's important just to stay tapped into the resources to see exactly what is the standard of care, because it may be different 2 days from now. And it's just a complete evolving process. So.
Yeah. Thank you. Now we're into the speed round because we're at 9:01 and we want to wrap up as close to an hour as we possibly can. Dr. Hashey, do you wear a mask all day or change between each visit, even if you're just doing a check for diabetes?
I'm working from home, so I'm not wearing a mask at all.
Okay. Either Dr. Scuderi then or Dr. Kumar?
Yeah, we've from a Chen Med standpoint, we've actually instituted that we're going to be wearing masks, the surgical masks at least. And if it's a COVID type patient, again, as I mentioned multiple times, we try not to have COVID patients even show up to be managed. But if we do, we have an isolation room that we can, you know, evaluate them, test them, and doing all those things. But we wear the full, you know, N95 masks, the face shields, the gown gloves, and personal protective equipment as recommended by CDC.
Anything else, Dr. Scuderi?
Yeah, similarly, you know, it's important, just you want to triage those patients, hopefully keep them out of your office and have them go to the appropriate places, you know. And for us, we're wearing a surgical mask during the day. When you're in common areas, if you're back in your office, you know, obviously you take them off if you're doing telemedicine. But if you're seeing patients in the common areas, we're asking our physicians and our staff to wear a surgical mask. Yeah,
and that's great feedback, because we had a similar question to it. Hopefully I'll be answering this appropriately, but and you've provided them with some good feedback, even though the question was slightly different in terms of flattening the curve because of wearing the mask. I can tell you that as of today, we're working with the AFP and making sure that a policy statement is a little more definitive through the AFP at the suggestion of our board chair, Michelle Brandhorst, and making sure that all of our members are wearing masks at all times to prevent the spread as best as possible. So with that,
hey, Jay,
I am going to.
Jay, I just want to add something to that real quickly. There was a really great New England Journal of Medicine article that was published yesterday related to the use of masks in hospital. And what it boiled down to is that, yes, you could use masks, but it's only but one thing. Using masks, social distancing, using gloves, all those kind of things in an additive nature in the hospital setting actually improves it. But what improves everything overall is that social distancing.
Yeah, great point. Great point. All right, well, I want to thank all of our panelists for doing a fantastic job tonight. We really appreciate not just the time you spent tonight, but we put in a lot of time trying to get the slides ready and the presentations squared away. So thank you very much for your time. We are going to, as mentioned, and on the screen in front of you, webinar number 3, you can see there will be same time next week. We'll be putting information out so people can register for that, and we hope that you will be able to join us. Any additional questions for tonight's panelists, please do email them to us and the information that we've sent out. You shouldn't have a hard time finding us if you need to get in touch with us. That's why we exist, and we appreciate hearing from our members. So I want to thank everyone, thank our panelists again, and hope that everyone stays safe during this time. Keep your distance, but you know, virtual hugs. And stay safe out there. Thank you very much. Good night.